Jennifer Conrad here. I'm doing a presentation on major depressive disorder. So I want to go ahead and apologize in advance. I'm going to submit this video and add it to my presentation. For whatever reason, I tried uploading the newest edition of Prezi and just could not figure it out. But I had already done all this work, but I did want to include my face here and the ability to kind of walk through what you're seeing as well here. So I basically did the presentation on major depressive disorder, which I also did my annotated bibliography on. I did have a difficult time with this, so bear with me. Hopefully I covered everything I needed to. I just felt like I don't know, it was kind of hard for me to just kind of come up with something with this. I'm not sure why, but just bear with me. So first things first, you'll go to in the presentation, the first slide that you will see is what is major depressive disorder. So I go into defining what major depressive disorder is, and according to the Nursing Made Incredibly Easy, major depressive disorder, also known as MDD, also known as clinical depression, is a profound depression mood that persists longer than 2 weeks. It's severe enough to cause noticeable problems in the patient's ability to maintain personal relationships, work or school obligations, and then not participating in things that they once enjoyed. So on the first slide, that's what you will see for that. Moving into the second slide, you will see that I noted, what are the symptoms for major depressive disorder? And I did note symptoms for adults, and then I also noted in the following slide symptoms for children because they are a little different there. So for depressive disorders for adults, according to the Diagnostic and Statistic Manual of Mental Disorders, the 5th edition, it did indicate that MDD is present when the patient experiences 5 or more of the criteria that I'm about to explain here in a duration of a 2-week period. So depressed mood, lasting most of the day, loss of interest in those previously enjoyed activities like I noted before, fatigue, loss of energy, significant weight loss, or change in appetite because it could go the other way, feeling of just worthlessness, excessive inappropriate guilt, maybe be delusional a little bit at times. Also, the client would have insomnia or hypersomnia, and then their change in activity would change. Also noted that the ability to think or concentrate were hindered, as well as just constantly thinking of death or suicidal or thoughts, or even creating like a suicidal plan. So for adults, that's typically what is looked for there. Now for children, symptoms may include sadness or worry, clinginess, irritability, having just kind of random aches and pains, and then of course refusing to go to school, not wanting to, and then as well as being underweight. So those are the symptoms of that, of those in children. And then just for a fact, I did include that according to research retrieved from the NIMH, children were estimated at 3 million to have depression worldwide, and I thought that was pretty significant there. So I wanted to include that, something that I learned there. All right, moving on to the causes, okay? So according to the authors of one of the articles I read of Not Just Feeling Blue, Major Depressive Disorder, they noted the exact cause of MDD is unknown, but physical and chemical changes to the brain, as well as hormone changes or genetics, were believed to play a role. And I kind of go in a little bit more detail with those. First, I noted the biological causes. And basically that is basically the chemical imbalances within the brain, as well as hormone changes, as far as the biological causes. Environmental causes as well could possibly be something to look for there. Environmental factors, which include financial hardship, mental or physical abuse or harm to the person, as well as grief, loss, heartbreak. Those could be the possible environmental factors. And then move into the genetic causes, possible genetic causes. I noted that genetic causes include the family history of depression. And I did note some research on that. I included one of the articles that I created the bibliography on as well. According to the authors of the genetics of major depression, the authors reviewed the evidence of genetic contribution to the disease susceptibility in the current state of the molecular approaches. The authors considered evidence for the genetic contributions. And then the authors did begin by explaining the prevalence of major depression and how it is the world-leading cause of morbidity. They moved into the research behind genetic studies, and then these studies examine the relation to genetics and the environmental factors. And considering that they noted that, I went in to explain a couple of their findings. So one of their findings, based on the 21st century data, showed a magnetic analysis of the highest quality family studies produced an estimated odds ratio for increased risk for MD in the first degree relatives. So first degree relatives, it were more significant found with those as far as having depression. I also noted in their research that while going through the studies, they found that, sex can also play a role in developing major depression, as it did show that more women compared to men developed major depression. All right, now we're going to move on past causes, and we're going to move to treatment. So two of the things that were noted in the research was the pharmacologic and then therapy, as well as behavioral therapies. And basically the pharmacologic, I think that's how you say it, that's basically the medications. And I'll note to you that. And then the therapies. So the medications include antidepressants, mood stabilizers, antipsychotics, and as well as anti-anxiety agents. So that's the type of medication therapy that they kind of use with those with major depression. And then moving into the types of therapy that are used, psychotherapy is used. And I did note one of the sources that was in my annotated bibliography. I noted that along with administering medications to help support the client, psychotherapy, or which they refer to as talk therapy, includes cognitive behavioral therapy and behavioral activation therapy. And then I just noted that it was important to note that some clients may require even more extensive amount of therapy, It just depends on the significance of the disease they have, of the disorder they have. Excuse me. Okay. Now that we have reviewed what it is, the symptoms, the causes, and treatments, looking at treatment plan. So, what do we do? Now that we know what it is, what it looks like, what do you do? So, based on the information presented in the presentation and the things that I've learned about MDD, a possible treatment plan, I think, would be to first assess individual and the symptoms that are occurring, and then goals will be set and put in motion to work towards living a more fulfilled life. Therapy will be in place, and the client may be given medication, obviously, as we learned, to help support the client, as well as using different therapies to help the person, the client. Okay. Now, I did note some in my research that determining treatment outcomes, that the therapists address treatment response based on measurement-based assessments and rating scales given to the client and completed by the therapist. So, again, this is something else that I learned in my annotated bibliography, some of the assessments that they use to determine the progress that they're making with the treatment that's being provided. And these assessments assess if treatment is working towards eliminating residual symptoms or maintaining full remission if they were to reach remission. So using these assessments and rating skills, I would assess client outcomes. And these assessments will be reassessed when needed to determine progress toward remission. And then there were some factors that influence remission, and factors that contribute to the success of treatment include impairments, and then other medical conditions may impact that. It's important to note that. All right. I'm sorry. I think I just went over that with you. Okay. All right. And then budgeting and planning, if I were to create a hypothetical treatment center, in order to plan a budget for that mental health program, I would consider situation analysis, just the assessing of what is the need at the time, and then that target setting, what is needed exactly, and then the implementation of services, what is going to be needed there. And you definitely look at what type of faculty you're going to need in order to plan ahead as far as budgeting is concerned. And then one of the budgeting implications to consider is, cost of, run community services, the capital cost of actually opening a staff care center, home in the community, as well as costs of clinical duties required for individual assessments of LOXA patients or inpatient care. And then obviously costs of training community staff to work with the clients, as well as costs of training centers, cost of training trainers or helpers. Okay. All right, so that's what I have so far. I don't know if I completely covered everything I needed to. Like I said, I was just kind of unsure about myself with this, but I did include on my last slide the references that I used to make the presentation. Thank you for your time. Bye-bye.